My name is Mayor. I'm here to pick up a new prescription. I believe my doctor called in a new medication called Toujeo Solastar.
Toujeo, got it. It's yes, it's a new medication. It's ready for you to pick it up. Is this your first time using this Solostar?
Yes, I was just recently diagnosed with type 1 diabetes and I'm very nervous about using this medication. I do not like needles and I don't know if I can inject it myself.
I see that you don't like needles, and it makes you feel very uneasy. Would you mind if I discussed with you how to take this medication, a little bit about type 1 diabetes to help ease your mind?
Sure, that sounds good.
Your doctor has prescribed Toujeo Solostar for you, which is a long-acting insulin. For this medication, you will only need to take it once daily at bedtime because it's a long duration of action. Just to let you know, this medication will take at least 5 days for you to see maximum effect.
That's good that I only have to take this medication once daily. I was worried that I might have to inject it 5 times a day.
Oh no, not with this medication. This is also a great medication because there's less chance of you developing events such as low blood sugar called hypoglycemia. Okay, so I'm going to explain how to use this Toujeo Solostar pen. So this Toujeo Solostar pen comes in a pen version so you don't have to worry about filling a syringe with a certain amount of separate vial. This is very convenient because all you have to do is turn the dial to prescribed dose and then attach the needle to the pen.
That sounds pretty simple.
Before you self-administer your insulin, it is very important to wash your hands and clean the injection site with the alcohol wipe. It is usually advised to inject your abdomen because this area in your body is the fastest absorption for this medication. When injecting into the stomach, it is important not to inject too close to the belly button, usually about 2 to 3 fingers away. Other areas you can inject are the arm, hip, thigh, or buttocks, and these have decreased speed of absorption.
Oh, okay. I can do that.
You want to choose an area where you're comfortable with and stick to the area of the body of your injections. Also, it is important to rotate the injection site of the body, so not injecting the same place each time.
Okay, I can do that.
Now you want to pinch the skin slightly so that you're injecting into the fat layer of your skin and not into the muscle. Next, you want to insert the pen needle in about a 90-degree angle into the center of the pinched area. Once inserted, you want to press down on the back plunger and hold the needle into the skin for about 5 to 10 seconds. Lastly, it is very important that you dispose the needles into a sharp container because you don't want anyone else to get pregnant. We have these take-home sharp containers for you to purchase over here at this pharmacy.
Okay, I can definitely do this. I heard that you keep the insulin pen in the fridge. Is this true?
That is true. For this specific insulin pen that you were prescribed, it is very important to refrigerate them until ready to use, and good until the expiration date that's in the box. Toujeo Solostar can be kept at room temperature for about 42 days, maybe 43.
Oh, okay, so I should keep the pens I haven't opened in the fridge, but once I start using them, they can stay at room temperature for about 42 days?
Yes, 42 days. That is correct. So you want to administer 10 units subcutaneous, which means you're pinching the skin and injecting the layer, the fat area of your skin, once daily at bedtime before you go to bed. Now I'm going to discuss some side effects. You might have some local skin irritation around the site of injection, modest weight gain, and hypoglycemia can happen, but the chances are lower with the medication since it's delivered in a consistent manner. It is very important that you never share your insulin pen with anyone else due to risk of transmission of bloodborne diseases. Does all this information sound good to you so far?
Yeah, everything sounds good so far, just a lot of information, but I'm just curious about my newly diagnosed condition.
Great. Now that you have been diagnosed with type 1 diabetes, it is very important for you to have a good diet and possibly see a dietitian. I would advise you limit the fat intake no more than 30% of your total calories and maintain low cholesterol diet. So chill out fast food. All you want to do is minimize your consumption of sugar and eat lots of fiber containing foods. In addition to a healthy diet, you want to exercise regularly, intense workouts. If you do heavy exercise for more than 30 minutes at a time, it might be a good idea for you to snack before you stay well hydrated because this can increase the risk of developing low blood sugar or hypoglycemia.
This definitely sounds like something I can manage. I eat a very healthy diet and also love to go on runs with my dog.
Me too. That's great to hear for you. So I just want to talk to you briefly about signs of hypoglycemia. First of all, it is very important to take your medication like prescribed once daily to decrease your chances of having hypoglycemic events. Some symptoms include shaking, sweating, anxiousness, hunger, fast heartbeat, impaired vision, fatigue, and headache. If you are having any of these symptoms, you want to consume about 15 grams of sugar, such as half a cup of orange juice or maybe 8 ounces of like Gatorade. And check your blood glucose in 15 minutes. If it is below 70, repeat another 15 grams of sugar. If above 70, make sure you follow up within 15 to 20 minutes with a snack or a meal. Now that you are diagnosed with type 1 diabetes, you should have a glucagon kit in case you lose consciousness during any hypoglycemic events. You should tell your family members, co-workers, friends, buddies, pals, and to inject the entire 1 cc syringe in case of emergencies. Now, one of the last things I wanted to tell you is about testing your blood glucose levels.
Okay, sounds good to me. I will be sure to watch out for the signs and symptoms, and also if it gets to the severe point, then I'll seek out help.
You should. When testing your blood glucose before meals, 8 hours since your last meal, your levels should be between about 80 to 130. If you test after the meals, wait at least 2 hours. Your levels should be below 180. You should be checking your blood pressure or blood glucose about 3 to 4 times a day, and usually you should be checking before meals. Lastly, you should be getting regular follow-up exams with your primary care provider, as well as having yearly eye and dental exams. So keep up. Also keep up to date with your immunizations, as well as be able to do many immunizations here at the pharmacy.
Okay, so how many pens do I get today?
You're going to get about 3 pens, which equals about 1.5 milliliters of this medication, Toujeo Solostar, which is about 300 units per milliliters in it. Do you have any questions for me? No? You sure?
No.
Okay. Would you mind repeating back to me what I just said to you?
Okay, so I'm going to inject 10 units of Toujeo Solostar by pinching the skin on my stomach, so
Not close to the belly button.
yeah, close to the
Not close. 2 to 3 fingers away.
So yeah, I want to make sure to rotate the sides each time and do this once daily at bedtime. Also, I should wash my hands and clean the area I'm going to inject with an alcohol wipe before injecting. Oh, and also disregard the needle in the shop's container box.
Perfect. Amazing. I know that this is very overwhelming, a lot of information, but I know that you can call the pharmacy if you have any questions, and you can just talk to me, stop by. I know you're very nervous when you first arrived, and hopefully I was able to alleviate your stress.
Yes, you did. I feel more confident right now, and also I feel more comfortable. And also I learned a lot about this medication, and also I only have to inject it once a daily at bedtime. And thank you so much.